where do you want to make a difference in a patient's life? And how do you do something that would give them a better quality of life and a better outcome?
I have Matthew and Susan for your emergency contacts.
We look at technology at Geisinger as how do we assist a care provider, a physician, a nurse, a therapist, someone who works in the health plan, a nurse at the health plan that's doing population health management. How do we make their lives a little bit better by serving up information to them where they can use it for decision-making purposes? Geisinger has been known for probably about the last 7 or 8 years at least, on a national scale and internationally, because we've used data to help us refine those business processes. We do a lot of automation, and we can support the providers, the doctors, the nurses, the therapists that work with our patients to be able to close gaps in care for those patients, to do some predictive analytics and predictive medicine to help support the patient. It starts with the electronic health record because we want to have a longitudinal view of the patient, meaning if they come to us in one of our clinics, the same information is present if they come in for an inpatient procedure, or they become sick and they're in the intensive care unit, or they just come to our EDs. And we want to make sure that we have the most current information that brings that information together. We also have a health information exchange, and we share a lot of information, which helps when a patient presents for an emergency department visit, or they come into their physician's practice and they may have had care somewhere else in the community. Medications, problems, allergies, information is always updated and shared through what's called a continuity of care document. In addition, we do a lot of analytics now where we have a large data platform that blends information from all different disparate parts of our system. It takes data that's structured, unstructured data, social media data, and brings all that information together to get a better holistic view of our patients. Data for us is extremely important to our organization.
Health information is a field where you're not going to be involved in direct patient care, but we are a function in healthcare that provides the information that others use. If the patient is in the emergency room and the doctor needs to know if the patient has any known allergies before they treat them, that's an important fact. Something simple as an allergy could mean the difference in saving a patient's life. If the patient comes in from an accident and they're unconscious and no family members are with them, we're only then relying on the information that we have available. If we can rely on that information and it's readily available and it's accurate and it's good information, it definitely helps improve the quality of patient care. So health information does save lives. Otherwise, if we miss a diagnosis or a procedure, computers have made a place for themselves in virtually every field that exists, and healthcare and health information is no exception. Today, with just a few clicks and a quick search of the patient's name, they can find their past information and start viewing it right away. And sometimes in healthcare, seconds can make a difference. If someone is in critical condition, having that information available instantaneously can make a difference.
There is a law called HIPAA that protects patient privacy, but what people don't know is that it also secures the patient record. So there are very strong requirements in our industry about how we are going to protect patient data and patient information. The layered approach is important. So you cannot log onto a computer without a password and an access code. No one gets in the door without an ID badge that identifies them, and it probably has a computer code on it that unlocks the door. It's multiple layers. In the back side, we work with the information technology department to make sure that there are controls in place like a firewall and a lot of other things that they can do to protect us from outside intrusion. We also will encrypt the data. We scramble the data and we send it. So if it gets intercepted while it's being sent, then they can't do anything with that information. And then on the other side, there's a little technology key that they use to unscramble the data. It's all done in a matter of seconds, and the data, it can be trusted, it's accessible, and it's accurate. And the technology allows us to do that. A student once said to us, I feel like I'm a detective. I read the story of that patient in their patient record, and from that, I'm looking for something specific. And so having that curiosity about finding out what's going on with the patient can be very interesting. Students need to have a background in physical sciences, so a little bit of anatomy and physiology. I like them to have a pathology background, understand disease a little bit, so when we get them into the medical coding classes, they have that understanding of what a disease process is. They need to be very accurate. There is not a lot of room for errors in our field. Having appreciation for numbers and being able to translate that into something useful. So we're not asking students to do complex calculus computations. What we're asking them to do is look at the numbers and let the numbers tell your story. And we're looking at the outcomes for a surgery or the outcomes from a particular type of chemotherapy or a medication. And health information professionals track that information. What do we do with it? At the end, your physician is going to make a decision about possibly care for a patient based on the numbers that we pulled out. The end result is for quality patient care. So even someone who's not hands-on patients, we would be looking at numbers that might indicate a trend in infection rates, and that's going to benefit the patient later.